Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
All righty. That's an interesting article that, as we've had the pandemic and so many things have changed. We don't know why or what, but we do have all kinds of questions being raised. Here you see uh, some doctors are noticing some cancers that they hadn't noticed before and wonder whether it was related to the COVID. And of course, there's some people who wonder whether it's related to COVID, whether it's related to the vaccine or the viruses or whatever. And so, as we have new things that happen to us, we are trying to understand what are the consequences of COVID and the COVID vaccine. And so, these questions emerge, questions, but no real answers, because it's kind of too soon to tell. But over time, we'll be able to get some of the answers. You know about the um, doctor in Florida who's alleged that the uh, COVID virus vaccines should be stopped because they are dangerous. Uh, so far, there hasn't accumulated much information to give credibility to that allegation, but over time, it's going to be interesting to see what happens as to whether or not any of this is related to COVID or not. But anyway, that's the question was raised. We don't have an answer, but it is food for thought. So I thought I'd just share it with you.
Uh,
Any thoughts?
yeah, my thought is okay, the question is cancer an inflammatory disease? And they say that that people that have cancer, their body is in inflammatory condition. And so, things like viruses, the COVID virus sets up inflammation in the body. So maybe that's. It seems like a lot of these diseases, if it's diabetes, cancer, the viruses, they're all inflammatory. Maybe that's the connection.
It's interesting that you mentioned that because we have never really uh, recognized anything as to whether it is an infection or it's an inflammatory state as a consequence of other things. But there's been many hypotheses that believe that it is, as you mentioned, an inflammatory process, but we haven't really identified the commonality of what happens in all of it, because we know that are certain viruses that cause cancer, uh, particularly in transplant patients where EBV virus, Epstein-Barr virus, for example, we know that causes post-transplant lymphoproliferative disease, which is a cancer. And when you knock out the immune response, the cancer goes away. So there's a lot of evidence that you're right that it is an inflammatory process. And so,
Yeah,
so, so, it's an interesting observation, and time will tell. But I think there's a lot of suggestion that it is an inflammatory process.
yeah. There's a hypothesis that's shared with a lot of people that follow a vegan diet that says that a vegan diet tends to be more alkaline. And when you follow a vegan diet, you avoid the things that create acidic conditions in the body, and that um, acidity. Of course, pH varies. There's blood pH, there's different pH for each organ, but your overall body pH, they say, is encouraged to be alkaline if you follow a vegan diet. The things that commonly are most acidic are things like alcohol, sugar, and red meats.
Any other comments about this interesting about the? Okay, if not, let's go to the next article, please. This is something that is problematic. Actually, Dr. Callender talked about some of this a couple of weeks ago, and we recognize one of the reasons is because when they go to the doctor, sometimes even the doctors miss the diagnosis. But in these days, tubular ovarian cancers are hard to pick up. Cervical cancers really should not even occur because of the vaccine and pap smears and other things. So having early death rates from these is something that may be related to not only the disease entities themselves, but people getting good care from their physicians and doing all those things that are necessary for an early diagnosis and prevention of these gynecological cancers. But it is disturbing that today we still have a higher death rate in our Black women compared to the white population.
That's so true. That my sister fell in that category. She was finally diagnosed with ovarian cancer, and she was having issues and was going back and forth to her primary care doctor, who she'd been seeing for years. And she wasn't diagnosed with cancer. The doctor told her she needed to lose weight. She was gaining weight. And one of the symptoms is the bloating, the swelling of the stomach, and I guess that's ascites, the swelling. So much so until she started wearing maternity tops. And then she was doing the best to lose this weight, exercising. And she took a swimming class. And, it was really sad. Finally, one day, oh, I think you have cancer. And by that time, she sent her to the hospital, sent her to the cancer unit. And yes, she was diagnosed, but she was already stage 3. And how does that happen? Again, Darryl mentioned this about a friend, didn't die from cancer, but died from a stroke. That was her situation. She didn't die from cancer, she died from a stroke. But I felt like she lost so many years with the late diagnosis.
And the tubular ovarian cancers, the one diagnosis that is hardest to make.
Yeah.
The others are easy to make, and it's unfortunate that that is the case. The tubular ovarian, we're doing better than we did with your sister, but we still aren't where we need to be with tubular ovarian cancer. Because the story with your sister is very common because an early diagnosis of tubular ovarian cancer is
Yeah.
and we have all kinds of surgical procedures for people when it's late, but when it's late, the likelihood of saving the lives is not good.
Yeah.
I notice the article doesn't talk about why Asian women have low rates of these type of cancers.
No, it doesn't. And it's interesting that while they have low rates in this area, they have high rates of gastric cancer. And we don't know why either. But one could suggest that they go to the doctor more often. They're diagnosed earlier. But I suspect they have a lower incidence of tubular ovarian cancer which is the biggest killer. And the fact that they have 1.6% with Asian women, this is very interesting. But to go from 14% to 1.6 is, wow, astronomical.
Yeah,
Okay, no other comment? Any comment?
yeah, not that Asians have a better success rate with all type of cancers because they typically have higher rates of liver cancer and stomach cancers, but they've got it going on for the ovarian cancers.
Yeah,
Go right to the middle of it.
let's go to the next article. Very,
Hit that arrow right here. And number 3 this way.
Carol, did you say something?
No, we got it.
Okay. Okay, now this is an article that talks about the new pneumococcal vaccine and the new COVID-19 vaccines, which I hope all of you have taken the COVID-19. They also have a newer pneumococcal vaccine, which they have improved from the maybe 10 valent pneumococcal conjugates to 21, which means that their pneumococcal coverage for pneumococcal species that weren't available before. And so the CDC is recommending that you get the new pneumococcal vaccine. It's just come out and I haven't gotten it. I don't know if anybody has gotten to the stage where they've gotten the new pneumococcal vaccine. But anyway, they are making us aware that this vaccine is more potent than the old one. I think there's still a concern that there aren't as many people who are getting the COVID vaccine as it was expected.
It doesn't replace or have anything to do with the pneumonia shots or anything, does it?
No, two separate entities.
Okay.
I think the one of the things that it is a little different is that they recommend that this pneumococcal vaccine for a younger population. Earlier, the pneumococcal vaccine was recommended for the older population, but this vaccine says 19 and above, which is amazing. Okay, let's go to the next one. Well, this is an interesting article that talks about the commonality of child food allergies, which is, as you know, that allergies can be treated. Go to the allergist and they allegedly desensitize you or hyposensitize you to foods you're allergic to, although probably the best treatment is to avoid them. But there's an increased incidence of these allergies, and I think some of you have talked about the fact that you didn't have allergies young life, but as you got older, you got allergies to food that you could eat before, and not sure about how you can address that. Actually, asthma, of course, is one of the common allergic diseases, as well as eczema, which is a common skin disorder associated with allergies. And going to the allergist and getting desensitized is one of the things that can be done. Peanut, of course, is one of the commonest ones. And the shellfish one as well is another one that, and people who do not take, who do not take, aren't very conscious of this, are known to die when they take food that they know they're allergic to. Of course, that's why people take around adrenaline with them. So in case they have an allergic reaction, I think their life can be saved. But anyway, so this is something that allergists can do something about. It's amazing how common it is. Any of you have any relatives with peanut allergies?
I do, and it's weird. My son Chris went in the military, and when he went overseas, they had to have shots. This is what he blames it on. And he came back, number one, allergic to fish. We're Catholics. We ate fish all the time. And we always had this thing, fish fry Friday. Every Friday we had fish. Every Friday he ate fish. And nuts. He's allergic to nuts, which I couldn't believe it. And a couple of years ago, we were at a birthday gathering. He didn't want the food, but yet he kept eating off my plate. And he tasted the crunch. He said, Mom, does this chicken have nuts in it? Yeah, you're trying to kill me. And he's running around in this mall area because it was a drugstore, and he got Benadryl. He drank the whole thing of Benadryl. And my daughter-in-law said, look, you've got to take him to the hospital. We were there for the grandkids. She said, I got to get the other kids home. Found the patient first, ran in. He couldn't talk, and I just yelled, allergies. He has allergies. They grabbed him, took him in the back. By this time, he's taking off his clothes. He's swelling. He's pouring sweats. He said, Ma, you know I'm allergic. I didn't believe it. He's allergic. And it just happened after or during or while being in military. Allergic to peanuts, allergic to fish. Because my husband loved fish. And every Friday before Easter, we called it Fish Fry Friday. We had big fish fries. Chris tries to maintain that tradition. All the family comes over. He gears up with the gloves and puts on a hat, doing the fish. And when he finishes, the eyes are bulging. He's red.
Really?
He does it.
Wow.
It's just strange. Yeah. But that's the only thing he can relate it to. The shots he received while being in the military. So I guess he has it for life. I don't know.
It's one of the.
It's strange, yeah.
It is. Yeah, see if I can get an allergist to talk to us about that, because that's a phenomenon that it's not understood why people's allergies change as they age. Some of them increase and some decrease, so it's a mystery.
Yeah.
Any other comments on this? If not, we'll go to the next one. It's interesting that in the field of OB/GYN, which that has actually been taken over a lot by women, that sexual harassment and bullying is common in that area. And this is something that I've seen a number of articles on that indicate that our profession has got to do better in the OB/GYN arena. Of course, in general, where women are, there are these concerns, but it's interesting that of all the areas, OBGYN is the area that is associated with the greatest amount of sexual harassment. This is interesting about male respondents as well as female. I have no idea why that is the case, but it's an interesting observation.
Okay, I back that up, John, where it says that 51% of male respondents, 51% sexual harassment.
Right.
But it says the next paragraph, the women were rarely the perpetrators, just 10%. Although when they were perpetrators, 57% of the victims were male. So if I'm understanding the math on that, that means that a lot of the male respondents that say sexual harassment, they're being harassed by both men and women, but primarily men.
Isn't that interesting? Except that the ironic part, of course, is that OBGYN is the field of women. I mean, in other words, the patients are all women. So it's an interesting data collection. And it goes on, and of course, there's an article that indicated that a number of women who were interviewed indicated they were treated, they were harassed by multiple sources. 250 of 907 physicians. Yeah. So it's interesting how it's so much higher in GYN rather than the other surgical specialties. Not quite sure I understand why. Since harassment is not accepted by any profession, any of the medical professions. And but that because we say that doesn't mean that sexual harassment is not practiced. It's just that it is the intent is to eliminate it, but we have not. And it occurs from in the faculty as well as our staff. Any other comments about this? It is a theme that is becoming very prominent because the medical profession is now probably about 60% female. Right, there's no more comment. We'll go to the next article then. Now this is an article that has had a lot of controversy because they back this new drug for early stage Alzheimer's. And it was done unanimously. And you take it once per month and an IV infusion. And there's evidence that if you take it early on, may make a difference. Of course, it's hard to pin down what they mean by early success, because does it mean that it's going to prevent you from developing Alzheimer's, or does it just delay the onset of Alzheimer's? And the fact that we have nothing that we use now that delays it at all sets the stage for this drug, which even if it only is effective for 20%, that's better than the 0 that we have right now. So the fact that this drug is now available, it'll be interesting to see what happens as a consequence of the use of this drug.
Hey,
Now,
Dr. Count,
Yes.
I'm sorry. This is Sylvie. Good morning, everybody. When the FDA approves various drugs, does that give a clear path for like Medicare and these other organizations to reimburse patients for the expenses associated with it?
Yes. I mean, well, remember, FDA can approve it, but it's the insurers who make the decision. But why FDA approval is good is that means they've had a study and it has been studied, so it's not experimental. If it's experimental, they're not going to pay for it. But if it's FDA approved, then yes, it is more likely that the insurers will pay.
Oh, okay. Oh, thank you.
Get the drug that the insurers will pay for. Yes.
Yeah,
Your conclusion is accurate.
I think I saw in the article that it said a 30-minute infusion. Is
Yes.
that like an IV for 30 minutes?
Yes.
Hmm.
Which is not long. They don't go into the detail of how long and the questions you would have is, and they use as an end point the change in the plaque size and whether or not that's going to result in reversion of the cognitive problems or not, and how long. Those are questions that you'd like to have answered. And in for the drug to get this far, that means they've had the phase 1, phase 2, and phase 3 studies, and the studies then indicate that it's a clinical benefit. And so, and when you have a unanimous feeling vote like this, that's a good sign that it's likely to be effective. This would be the first drug of its type that would really be effective. So, and this has just happened, so it'll be interesting to see what happens in the next stage. But mind you, this is only for the early phase. So if they've already gone beyond the early stages, this is not effective. Then comes the question, what when you say early stage, what do you mean early stage? If they're already getting lost, then it's not early stage. When you're talking about mild, you're talking about before they are getting lost. They just have mild memory changes, like the question that Carol mentioned, where they asked you to count back from 100 by 3. When you get pickups like that, that's about early. Any comments or thoughts about this?
Well, I'm just glad there's some type of improvement where they can find some kind of cure for this debilitating disease.
Yeah, so common among us as well.
Mhm.
Yeah.
And it's only in the early stages. So, they'll keep exploring and doing research to lessen that 30-minute time you know, come up
Well,
with
the
some-
30-minute time is not really very long. I think as long, if that's the only price you had to pay for 30 minutes every month, that's a mild price.
yeah, yeah.
If it's effective and then actually it really delays since for a long period of time the progression of Alzheimer's, because you're right, the disability is so profound. And if you have people who, and all of us have seen people who have developed dementia, such a hopeless situation. So any hope is a great hope for now. Okay, if there's no comment, we'll go to the next article. This is an interesting article in which this doctor complained about harassment and was ignored and then was fired. And then when they went back, they felt that as a consequence of his complaints, that they fired this person. And this then resulted in him going to court and her going to court and actually having a $14 million decision. Yeah, it's interesting. UCLA has had some issues, but actually all schools had these gender discrimination issues. And then the question is, when you go to the court, one court says yes, the other court says no. And one of the problems is that it is not inexpensive to have attorneys and going to different courts. So when we gave an even higher award than the lower courts, it's almost like a punishment for forcing them to have to go to the higher court, which is interesting. What this does, though, it forces other universities to take note and to be very conscious of these kinds of behaviors, which are common at many institutions. The gender pay disparity is something that we're well aware of, but has to change because of the Title IX and other things that are put into practice. So these are things that must change, and decisions like this in the court will help change behavior. Any comments about this, the gender issue? And if the question is, does it still exist? Yes, as it is. Why is it as wide as it once was? Not as wide, but still, the gender pay disparity remains. Unless, I think at Howard, they actually took a look at that and found the discrepancies and disparities, and they made a change. And unless somebody does that, the pay disparities will persist. But actually, that actually was changed at Howard because they actually looked at it, and it was disparate, and it was changed. Any comments about that? Now, they do that in medicine. The question is, they're doing it in other fields as well. Elizabeth, you have a comment?
Yes, I totally agree. Right, right before we were moving on the screen, when you were talking about um, uh, I made the statement to myself about, and I think I texted, not reported, and what it was, the retaliation.
Yeah,
When you
right.
work, when you worked on and have had firsthand experience of this article, it's almost like walking in her shadow, because when you've experienced these kind of things, so you know it's absolutely true.
Yeah.
In my day, you know, we didn't have the internet, so when this kind of things happened, and my husband and I discussed it, you know, we were deciding to move to another city anyway. So when I resigned, I just wiped that off my list. But these things, I'm a witness that these things did happen.
And they continue to happen. And unless somebody actually looks at this and then decides they're going to look at all of the gender pay disparities, they would go unnoticed. And then, as you mentioned, the retaliation that you get when you raise it is something that is frightening. And so this kind of case helps decrease that situation.
Yeah, privacy is something that's always advertised to help the employee, but so that's why they say that we'll keep your salary private so no one else knows it out of respect to the employee. But it really helps the employer. I
Right.
think employees benefit if everybody's salary is posted and is public knowledge, or at least available for whatever organization that you're working in, because that keeps, um, you know, you'd be surprised if you actually found out that a coworker that was doing half the job that you was making 50% more, because you say, wait a minute, is this the good old boy system at work again?
You are so right, Darryl. So right. Elizabeth, you had another question, or is that the only end?
Yeah. In a comment to that, DCPS, the Washington Post posted teachers some years ago. They posted the teacher's salary. I'm sorry. I apologize. I had background noise. Posted the teacher's salary in the newspaper. So, I do
which is frightening, because to think that our students are taught by teachers who receive so little pay for so much work is frightening to me.
Yes. And when they decided to, we went through an era where they released, they found a way to release 200 to 300 teachers, all Black. And then they had a program, I won't call it the program, but they had another program where they brought in younger Caucasian teachers.
Yeah, cheaper. It's amazing the games they play, huh? Yeah.
Yeah, absolutely.
Yeah. Okay.
One last comment on that harassment. I experienced as an auditor. I worked as an auditor for a bank, and I was hired by two supervisors that we had a great relationship with. I mean, excellent relationship with. And one of my supervisors was moving to Texas to another large bank. Him and his wife wanted me to come and help him with the bank as president. And so I wasn't ready to leave that city, and I wasn't ready to live in Texas. And so I told him, no, not this time. But immediately after he left, they hired another guy that was not so friendly. And then they hired Caucasian lady in our female audit team, and she was not so friendly. Where everybody in that team got along and we supported and helped each other. But when they hired those two people, and the supervisor that was left came to me one day and he says, Elizabeth, they're trying to lower your salary because the new supervisor has come in and found out that you are paid more than all the other female auditors. And we explained to him your education, your experience. And they had taken a lot of my ideas and revamped the auditing department. And so again, my husband and I discussed it and we said, okay, we moving to another city anyway. So resign and left that behind us. So these things truly, truly exist and still exist.
Right. Okay, let's go to the next one, John. This is something I thought might be interesting to our population, which has a lot of teachers in it. And one of the things is that with doctor-patient relationships, patients with intellectual disabilities have a hard way to go in many ways. So they have to be properly supervised, and the supervision has to allow them to make informed decisions. And sometimes the intellectual disability makes that extremely difficult. Whenever anybody has to have any kind of medical procedure, you have to have proper consent, and this then requires the appropriate person who is in charge of that particular intellectually disabled person. And because autonomy is one of the most important aspects of health. And this then becomes an issue when you have somebody who's intellectually disabled. And I'm sure that you as teachers have to deal with this. And the question is, how do you deal with it as teachers? With in the health profession, and we have to have the person who is in charge of that person to work with that person to make sure that this is done with the appropriate informed consent. And this is something that it requires a high degree of sensitivity. Any comments about this as you look at this from a teacher perspective? I know in medicine, a lot of times we take the word of the person who is that person's guardian. How do you deal with that in the educational system as teachers?
I
Darryl?
would just like to say, first of all, in the educational arena, you just use common sense. You don't assume, especially when they're children or youth, and you know they have an intellectual disability. So you don't ask them questions when you know that they can't answer. You can legally ask their guardianship or et cetera. If you don't think they make the right decision, then you turn to the authorities. But I guess in medicine, it's actually different. You've got to, once they reach 21 or something, you have to not use common sense, but you got to ignore that they have this disability and treat them as if they had this ability and proceed, which is, to me, is ludicrous, but I don't know.
Well, if they have an intellectual disability and they cannot comprehend, then they have to have a guardian who has to be accountable. Because and we have ways of determining whether they're intellectually able or not. We have the psychologists and psychiatrists evaluations. And if they are not competent, then somebody has to assume the responsibility, whether it's the court system or a person who is appointed as a guardian. It seemed to me that it would be even more difficult in the educational system because you don't want to go to court for every case. Whereas in medicine, if it comes to that situation, we would have to go to court if there wasn't a proper guardian who had the right to speak for that person. Because autonomy is pretty much mandatory.
I think it's easier in education because if they're 4 years old or they're 10, 12, you treat them for what age they are. Now, they might have this intellectual ability, they could outthink you, but you're going to just treat them for what that age dictates. But we've had children that were 21, but they were in the special needs section. And that was before all this jargon came out in education. Everyone can be what they want to be, learn what they want to, even if you have a low IQ, you still can be a neurosurgeon. That's in education. They'll say that if you just believe in yourself, but it's all rhetoric, and everybody knows it's rhetoric. Mostly everybody. But they say get the children to believe that they can do anything that they put their mind to. So, to me, it was just jargon. But I guess people really buy that hype.
Well, it's interesting that is the IQ test that was used, is that used for or against people? That's the question. Of course, you have an IQ of 100. Does that mean that you can or cannot do something else? And so, are there people who, in spite of their IQ, manage to accomplish the so-called impossible? Elizabeth, you wanted to say something.
Yes, the paragraph that says at the end, the first step towards fostering an environment where patients feel respected and understood. And that's teaching as well as dealing with my mother when she was in the rehab as a dementia patient, being treated for other concerns. But I too agree, as an educator / professor, because I taught all ages from pre-K to teachers. So I always kept the motto in my heart: accommodation and the love of what I do, imparting that knowledge for children, and teaching with protection and using common sense. And because I have several examples that I can remember that I had great success with. And I love teaching that highest grade in elementary because I knew that I had to do everything for them because I will be their last teacher that they will have all day to be able to observe them and work with them holistic.
Any other comment about this article? If not, let's go to the next one. This is interesting. We have a high rate of burnout in physicians already, but to talk about physicians with disabilities having an even higher rate of burnout. One of the real issues in medicine, close to 49 to 50% of physicians had burnout, particularly was over 50% during the pandemic, but afterwards it's dropped down below 50% to 49%. So that that's a problem, a problem with the fact that the doctors and healthcare professionals were dying because of COVID. COVID was one issue. The other issue was the fact that they were working so hard and doing so many different things and losing patients caused the burnout. When we talk about burnout, we mean that you get so much anxiety and depression as a consequence of what you're doing that you either quit or you just give it up. And this is happening in medicine more now than ever before. And so it requires a special attention. But especially this becomes an issue with the disabled population of physicians. And we have a number of physicians who have disabilities. And so they already have issues and then add all these other issues to it. And so the burnout then becomes an even greater problem. But the greatest success is when you allow people with the disabilities to have their anxieties and depressive issues addressed. And there's so many factors that go along with why people have burnout. And one of the commonest is not giving them the opportunity to have accommodations for their disabilities, just as you mentioned, Elizabeth, before. And so the institutions do bear the burden of addressing those issues that give the people with disabilities accommodations that are necessary so that they don't burn out. But those that have disabilities more likely to have burnout than the others. So this is something that is now one of the priorities in the American Medical Association, is addressing burnout in the disabled as well as the abled populations, because it's high in both. It's just higher in those with disabilities. Any comment? Because burnout is present in all professions, but it's becoming now even more of an issue in the medical profession. And it's become clearer that it is the institutional's responsibility to make it a priority to address those issues. And yes, many of the physicians have mental illnesses as well. And we have not been very responsive to those physicians who have anxieties and depressions that and negatively impact their performance as physicians. And one of the things that we don't do is to make it easy for people with disabilities, whether intellectual or otherwise, to seek help and to get help and not be penalized for it. Any comments about this issue?
I got a comment because let's see, we got doctors on this panel, we got teachers and musicians are really prone to burnout too, because you always hear about some artist that's on tour and they have to cancel a performance because of exhaustion, and that's real.
Yeah.
And like people just don't realize the stress that a lot of working musicians are under. Like your days easily, you could have 12-hour days as a musician, especially like if you're touring and you're doing concerts and festival shows, that type of thing. But you go for long periods of time. Well, okay, your schedule gets irregular, and so your sleep patterns are different. Like during the week. You tend to go to bed earlier when you're performing. you get so hyped up that it's hard to go to sleep right after you get back from a gig. And so, those may be nights where you wind up getting to sleep at 2 or 3 o'clock in the morning. But it's a real tough life being a musician.
That's interesting. I never heard that side of it discussed by anybody before. Mark?
Yeah, good morning, everybody. So, burning out is real. When in my studies this past spring, they said that teaching is one of the hardest professions that there is out there. So thanks for mentioning that, Darryl. But yes, I agree, teachers and musicians, and I happen to be both. So I guess this is where I get the gray hair from. But I tend to think that, just including all these professions they mentioned in this article, that all frontline workers, when anytime you have to deal with the public and deal with people and you have to be on, there's a sense of burnout there. So I think we could all be a little extra sensitive to those people who are frontline, front-facing service industry people, that because the tendency for burnout for them particularly is particularly high.
Thank you. Any other
So,
comments?
yeah, like the article says, when you get busy, you got to do things like practicing mindful meditation, exercise, eat right. You got to take care of yourself.
Yeah, it's interesting. I wasn't as sensitive to the musician burnout as you are, but your points are well taken. You have so many musicians, entertainers who are exhausted, and I often wondered what they were exhausted from. But I think you clarified it well. Any other comments?
Yeah, just a little more detail. Okay, like this is kind of typical, especially like summer months where musicians get really busy. So let's see, I've got a show Thursday night. What really gets difficult is Friday night show is over at 11:30. I don't have to tear down because I'm at the same place on Friday, but I'll probably get back home, get to sleep at 1 o'clock, where I've got to set up for an outdoor festival that goes from 2 to 4. So that means that I've got to be on location at noon. Um, uh, so I gotta eat, get cleaned up, set up. Festival's over at 4. Tear down the set. Another show starts at 7:30 to 11.
Yeah.
11:30. So that night I got to tear down the set. Probably don't get to bed until like 2 in the morning. But then another festival on Sunday from 4 to 6. But it's like there's no downtime in that window from Thursday till Sunday at festivals over at 6 o'clock. Tear down the set, get home at 8 o'clock. There's no downtime from Thursday to Sunday at 8 o'clock. Constant motion, a lot of physical activity. I'm dancing on stage, playing instruments, singing, set up and tear down hundreds of pounds of equipment. I get a heck of a workout, but come Sunday night at 8 o'clock, I'll be exhausted.
Mark had additional comment?
Yeah, I did. The notion that you love what you do is I guess that's considered the fuel for our energy, but that fuel can sometimes run low. Yes, you do love what you do. You enjoy your line of work, but bringing it back to the article, talking about physicians, I really, really empathize with them because, their hours are much longer, 12+ hour days and such. And, yes, to a high degree, you enjoy what you do, but I think that's the only reason why you could push through. And so now I'm including all three, whether it be physicians, teachers, or musicians. Like if you don't enjoy what you do, it would really, really wear you down faster. But that would be the only reason why, somebody could even choose that line of work. It's got to be love.
Very well expressed. Very well expressed. Yeah. Because, you know,
I
I know.
think, burnout in anything, if you're too busy and you don't have the time for meditation to relax. Even Jesus went off by himself. If you're inundated with what you're doing day in and day out, and no time for meditation, relaxation without the stress, everybody can get burned out. And I'm sure physicians, Dr. Callender, you were telling us about, your internship and the hours they were ruling and etc. But don't some of the interns get burned out during that process?
Yeah, oh, yeah, they do. Burnout is interesting. It's different from exhaustion because exhaustion just means that you're tired and you're right in terms of the hours you work a day. Sometimes you work 24 hours a day. Sometimes it's less. There are some who are less motivated who burn out more quickly. And the greater you're motivated, the more you love what you do, the less likely you have burnout. I think that it is something that is true for the three professions that you mentioned. And I think the institution involved has a burden to try to make things as easy as possible and make it possible for you to get mental help when you need it. And that's something in the medical profession that once you say you have a mental issue, it's hard for you to get a job. And so it becomes a problem. When in point of fact, if you have depression or anxiety, you need help. And we need the institution more sensitive. In the musical field, it doesn't seem that there's anybody to help you with that. And it seemed to me that that is an interesting issue. Yeah, you're right. Teachers do get a summer break. That doesn't exist with physicians and the musicians either, I guess.
So how do physicians adhere to this article? What are they doing in their line of training?
Oh, well, there's
knowledge and don't use it is to no use.
well, no. The institutions are now much more sensitive about wellness. In the past, when I came through, there was nobody discussed wellness with the physician. Physician was just the physician, period. Now, the institutions have a specific issue regarding wellness, and they have a responsibility to provide opportunities for meditation, for exercise, and for proper nutrition. So things have changed a lot, and the institutions now are addressing many of the issues that are associated with burnout.
We have one cousin who was a physician and she became burned out and had to stop altogether. And she thought about even being a secretary, something that was not totally out of her field. And I'm sure you've been acquainted with other physicians that were burned out and just turned to another field completely.
Yeah, so and that's a good point, and I think that's something that is now addressed. In the past, it was not even addressed at all. Now it is addressed. Residents' wellness is an important part of their training.
And I
Yeah,
think a lot of that, the quality of life, the youngins won't do what older people would do, definitely in the field of medicine. 36 hours on, 12 off as an intern. There's no current medical student that would do anything like that. And so generationally, even as the field has changed, um, taking over practices and things of that nature, very, very, very different um, uh, definition of quality of life inside of us.
Well, it's interesting because now female residents have pregnancies, they have deliveries, and then they come back and finish their residency and those kind of things, which didn't happen before. So that the attention towards the wellness of the trainees is a new high now. But the one thing that people don't realize is that once they finish the residency, they go into training, they go into practice, and there's no accommodation for that in practice unless you have a group practice. So it's interesting that yes, the residency program will allow you all that, but once you get into private practice, the question is that going to be maintained? Anyway, this is a good article for thought and discussion, but the medical field is addressing it more than ever now. Let's go to the next article, please. That's interesting. Being well-paid physician, he says, is an issue. Well, yeah, perhaps. Funny, I never really thought about the money, but anyway, I guess others do. So. This is an interesting article that whether or not the newer anti-diabetic drugs lower the stroke risk, and so we've got these new medications that we didn't have before, and it's thought that they do decrease the stroke risk, but the fact is that if you have an anti-diabetic drug, then your hemoglobin A1C is closer to normal, and that itself would decrease the stroke risk. So the combination of things is something that you would expect that it would lower the stroke risk. And the question is, will our studies are adequate to reflect that difference? These new agonists that we have seem to actually provide more prevention for stroke than the others, than just simple insulin. And so we have a new class of anti-diabetic drugs, which I think does do that even better than the previous drugs. Do you have any diabetics among us?
I've been given that diagnosis.
Mm-hmm. Okay. And what are your thoughts about this article? Think that it's true that these new diabetic medications are even greater prevention for stroke?
I can't speak to the article, unfortunately, but I can speak to the fact that I hope so. That as we are moving in that direction, absolutely.
Yeah. Any other comments?
I
on
know
this?
a lot of type 2 diabetics that have been frustrated by the anti-diabetic medication that has been in short supply because
Oh yeah,
it's being used for obesity.
yeah.
And I know a patient that just could not keep it. Every time he went for a refill, they were on back order, on back order, on back order. And with the limitations that we have because of pharmaceutical insurance, you can't get it early. The insurance will only kick in after a 30-day or a 90-day supply. So all of those other restrictions impact us.
Yeah, you're right, and that's something that many people don't recognize, that the fact that this is now an anti-obesity drug has made it difficult to get for many patients, and so this is a complication that is not even addressed. Okay, let's go. I guess one more article.
One other thing to that. So many of the people that are being treated for obesity online, the whole issue of patient-physician relationship is totally gone.
Yeah, that's tough. Okay, what's the next one? Because this will be the last one. Got to leave at 10:30. Oh yeah, this is actually we kind of talked about this at the beginning of the group session, and that is that not only, in first place, people who out in the sun are likely will get skin cancer if they don't use sunscreen, if they don't use ultraviolet ray protection. But what is problematical for people of color is that the use of the sunscreen may be a problem. And so you got a double whammy. That if you don't use sunscreen, you get a cancer. On the other hand, if you try to use sunscreen, some of them are not. They don't agree with our complexion. Elizabeth, you had a comment. Oh, you didn't have a comment? Okay. All right. But anyway, I think this is an issue that we have to keep in mind, that because we have protection because of our pigment, is not enough to prevent us from getting cancer of the skin, and the basal cell cancer and the squamous cell cancer, and then of course the malignant melanoma, which Bob Marley died of, are things that are important. So it's important that we do get sunscreens that are effective, that knock out the ultraviolet rays. And so those people who go to the beach without sunscreen are asking for skin cancer. And so, yes, you should use the sunscreen, but then you got to use the sunscreen that is compatible with you. And so one of the things that they've observed is that people of color have had some issues with the sunscreens that they have available. And so how many of you have used sunscreen when you go out in the sun? Maybe you don't go out?
I do.
Mhm.
On the
Any
beach,
trouble with-
not
any trouble?
not as much on daily activities, but definitely when I know I'm gonna lay in the sun.
Yes.
With it,
Elizabeth, you had a comment? Oh, okay.
I was just agreeing, yes.
Yeah. Any of you have any trouble with the sunscreens that they have available in terms of not being able for them to be comfortable with your skin? Because this article is saying that a significant number of people of color have problems with the sunscreens that they actually give out, and more people of color than the people who are not of color. Of course, people who are not of color get more skin cancer anyway, so that's an issue.
I haven't had a problem.
Yeah.
But now I'm alerted to this. Mainly it was coarse and something that was not too greasy. So it was, I didn't scrutinize my sunscreen,
Mhm.
but now I'm alerted to it.
Really? Yeah. So, well, that's the kind of thing they're talking about.
Dr. Callender, it says it's important for clinicians to recognize and address the specific needs and challenges that skin of color patients face regarding sun protection. I don't know what to look for. What are you supposed to look for when you're out in the sun? Or what challenges do I have? They have to tell me what challenges I have.
Well, the challenge you have is the same challenge that people who are white have, that the ultraviolet rays cause cancer. And so if you go out and you don't protect yourself with a sunscreen that knocks out the ultraviolet rays, your likelihood of getting cancer occurs. However, what they're saying is that not only do you have to address that, you have to also be sure that the sunscreen that you have is you're not allergic to it, or it doesn't cause complications of your skin to give you some kind of dermatitis. So that what you're trying to avoid is the ultraviolet rays, but you don't want to have the cream or sunscreen medication to interfere with the skin itself. And so that's all it's saying, is that that people of color will have more trouble with the sunscreen that they have available than people who are not of color. But the risk of the cancer is still there. It's just not we don't have as much skin cancer as white people do, but we still have skin cancers, and we still have malignant melanomas. And so it becomes important to know if you have a bump that doesn't heal within a short period of time, if you have a bump that is asymmetric, if you have a bump that has no border, if you have a bump that increases in size or changes color, those are issues that make you believe that you may have a skin cancer. And a skin cancer has to be diagnosed and treated and removed so it doesn't metastasize.
Okay, my take on that is that Black people have to watch the strength of the sunscreen. So I think stronger strength is something like SPF 70, and the lower levels, SPF 20 or 30, something around that range. But if you're taking a higher level and you've got some dermatitis, you've got some irritation, you need to drop it down to a level that's comfortable so you still get enough protection without the dermatitis.
I think that's a better way of saying it. Thank you, Darryl.
You're welcome.
I also think that since we're looking at people of color, this is a good opportunity to buy black.
Is it do what?
Buy black. Buy from a Black producer of sunscreen products.
Oh, okay. All right.
Hey, Dr. Callender, when I was looking at this article, I was thinking about maybe myself. I'm like, I'm one who don't even go out there and sit in the sun. So I was under the myth that a lot of us, people of color, don't even sit out there in the sun and as I see our other Caucasian people do. And so I was thinking when Dr. Lucille said, she sits out in the sun, I was like, dang, how many of us people of color just want to sit out there in the sun? Most people I know don't want to do that.
A lot of us still do. You go out to beach.
What you got to realize that it's a monkey see, monkey do world. It's a lot of imitation, and America is a sun worshiping country, more so than the rest of the world. If you look at white people, they're if it gets above 40 degrees in most parts of America, people are wearing shorts, short sleeve shirts. They're almost getting naked, trying to get as much sun as possible. And a lot of blacks, especially the young, are imitating that. They see it on TV. They see it in social media. And we got a lot of black youngsters that are getting a lot of sun because just of imitation. Like say you go to Europe, it's rarer to see white people in shorts in Europe. They're not as sun worshipers as we are here. And it goes back to a misconception that Americans had in the early 1900s that the way to combat tuberculosis was to get a lot of sun. So, they developed rooms they call solariums. And even though the treatment for tuberculosis, they find out that antibiotics was the effective treatment, but there's still the misconception in America that sun keeps you healthy, that you can avoid tuberculosis. And so, this has just been a sun worshiping country ever since.
Okay, I'm going to have to leave now. So I do want to tell you that we have a presentation for next Thursday. Dr. David Bowen, who is an expert on nutrition and nutrition as medicine. And so he's going to present that to us, a discussion that we have often, but he's going to give us a medical perspective of it that I think he's very well trained along these lines. I think invite as many of your friends to be with us next Thursday for Dr. David Bowen's presentation.